805,000 Americans will have a heart attack this year, and for 1 in 5 of them, it will happen without a single chest pain. Most people think they know exactly what a heart attack looks like. They think they are prepared. But when the real thing hits, they waste the most critical 5 minutes of their lives doing the exact wrong things. In this video, I'm breaking down the exact 3-step survival protocol paramedics wish everyone knew. By the end of this, you will have a mental muscle memory that could literally save your life, or the life of someone sitting right next to you. But if you click away, you're going to miss the cough CPR myth that is going viral on social media right now, and why trying it might actually kill you. Stick with me. Welcome back to 30-Day Health. If you're new here, hit subscribe because what you are about to hear is going to blow your mind. Look, here's the reality. People are conditioned by Hollywood to think a heart attack means clutching your left arm, gasping for air, and collapsing to the floor in a dramatic fashion. That's what we see in the movies, so that's what we expect. In reality, it often feels like bad indigestion, a weird ache in your jaw, or a sudden wave of exhaustion that just drops you. Because of this massive gap between expectation and reality, people go into deep denial. They lie down on the couch to sleep it off. They take an antacid. Or worse, they try to drive themselves to the hospital to avoid making a fuss. By the time they finally realize how serious the situation is, the golden hour for saving their heart muscle is slipping away. The golden hour is that first 60 minutes after a heart attack begins. This is the window where you have the highest rate of survival and the best chance of preserving your heart muscle. You need a zero-hesitation game plan. No guessing, no waiting to see if it passes. The absolute first move you make is dialing 911 immediately. Never drive yourself to the emergency room, and never let a friend or family member drive you. I need to be completely clear on this because it's the most common fatal mistake people make. You might think driving yourself is faster. You might live only 5 minutes away from the nearest hospital and think you can beat the ambulance there. You can't. Here's why. Ambulances aren't just medical taxis. They are rolling emergency rooms. The second those paramedics walk through your front door, your treatment begins. It starts in your living room, not at the hospital. They can run a full 12-lead EKG right there on your floor. They can transmit that data directly to the emergency room doctor while you're still in your house. They can start IVs, push life-saving cardiac medications, and get oxygen flowing into your system. If you drive yourself, you get none of that. Wait till you hear what happened when a guy tried to drive himself to the ER instead of waiting. A few years ago, a man in his 50s felt a crushing pain in his chest. His wife told him to wait for the ambulance, but he insisted the hospital was just down the street. He grabbed his keys, got in his truck, and made it about 4 blocks. Then, his heart went into a lethal rhythm. He passed out behind the wheel, his foot slammed on the gas, and he drove his truck through the front window of a local business, causing a massive secondary accident. He turned a manageable medical emergency into a fatal crash. If he had just sat on his couch and called 911, the paramedics would have been there to shock his heart back into rhythm. When you call 911, put your phone on speaker immediately. Set it down on the floor or the table next to you. The very first thing you say to the dispatcher is your exact address. Don't start explaining your symptoms yet. Say your street number, your street name, and your apartment number. If you pass out 10 seconds into the call, they already know exactly where to send the fire truck and the ambulance. If you start with a long story about how your chest feels and then pass out before giving your location, they have to waste precious time trying to ping your cell phone tower to find you. Address first, symptoms second. Once the dispatcher is on the line and help is on the way, you move to the second core step. You need to chew 1 full-strength uncoated aspirin. We're talking about the standard 325 milligram pill. But the craziest part about how aspirin actually interacts with your blood is still coming. You see, a heart attack happens when a plaque inside one of your coronary arteries ruptures. Your body treats this rupture like a cut on your finger. It sends blood cells called platelets to the area to form a clot and stop the bleeding. But inside a tiny artery, that clot grows incredibly fast. Within minutes, it completely blocks the blood flow to your heart muscle. that muscle starts starving for oxygen and it begins to die. Aspirin is a powerful antiplatelet drug. It literally makes your blood cells less sticky. When you chew that 325 milligram aspirin, it stops the clot from growing any larger. You have to chew it. Don't swallow it whole. If you swallow a pill whole, it has to travel down into your stomach, sit in your stomach acid, dissolve slowly, and then pass into your intestines to be absorbed into your bloodstream. That entire digestion process can take up to 45 minutes. You don't have 45 minutes. When you chew the aspirin into a paste in your mouth and then swallow it, it gets absorbed rapidly through the mucous membranes in your mouth and goes straight into your bloodstream. It can start working in as little as 5 minutes. You want to keep uncoated aspirin for this. Don't use the enteric-coated ones that have a shiny candy-like shell, because those are specifically designed to resist breaking down quickly. If you only have baby aspirin, which are 81 milligrams each, you need to chew 4 of them to equal a full dose. There is a famous case study in the paramedic world where a patient was having a massive heart attack, known as a widowmaker. He chewed an aspirin right as he called 911. By the time the EMTs arrived, his artery was still completely blocked, but the aspirin had kept the clot from solidifying entirely. It kept the vessel just open enough for a microscopic trickle of blood to get through. That tiny trickle kept his heart muscle alive just long enough to survive the transport to the cardiac catheterization lab. Chewing a standard aspirin during a heart attack has been shown in studies to reduce the mortality rate by up to 23%. That's a massive number for a pill that costs pennies. The biggest mistake people make here is taking Tylenol or Advil instead. Acetaminophen and ibuprofen do absolutely nothing for blood clots. They might help a headache, but they won't stop a heart attack. Keep the right aspirin on hand. If you're realizing right now that a heart attack doesn't always look like the movies, hit that like and subscribe button. Getting this information into the algorithm could genuinely save a life today. Now, while you're chewing that aspirin and talking to the dispatcher on speakerphone, you need to get into the proper physical position. This is the third core step. Don't stand up and don't lie flat on your back. You need to assume what we call the W position. Lying flat on your back is one of the worst things you can do when your heart is failing. When you lie flat, gravity causes blood to pool in your chest and abdomen, which actually forces your struggling heart to work much harder to pump that blood around. It increases the physical strain on a muscle that is already dying from a lack of oxygen. On the flip side, standing up or pacing around the room is incredibly dangerous because if your blood pressure drops suddenly, you'll pass out. If you pass out while standing, you'll hit your head on the coffee table or the hard floor, adding a severe traumatic brain injury to your heart attack. The W position is the perfect middle ground. You want to slide down a wall to sit on the floor. Keep your back fully supported against the wall. Then, pull your knees up toward your chest and plant your feet flat on the floor. Your body should literally form the shape of the letter W. This position does a few incredible things for your body. First, it naturally lowers your blood pressure just enough to take the physical workload off your heart muscle. Second, it drops your diaphragm down, which opens up your chest cavity and makes it significantly easier to pull deep breaths of air into your lungs. When your chest feels tight and heavy, breathing becomes a massive chore. The W position mechanically assists your breathing. Finally, if you do lose consciousness while sitting on the floor with your back against a wall, you'll just slump over safely. You won't take a dangerous fall. Once you're on the floor, chewing your aspirin, you have a few critical tasks to manage while you wait for the sirens. The very first thing you need to think about is your front door. The moment you get off the phone with 911, or even while you have them on speaker, you need to make sure your front door is unlocked. If you're home alone, this is quite literally a matter of life and death. If you lock your door out of habit and then you pass out on the living room floor, the paramedics are going to arrive and find a locked house. They can't just magically walk through walls. They'll have to call the fire department to bring heavy tools to break down your door. Or they'll have to smash a window to climb inside. That forced entry process takes time. It wastes 2, 3, maybe 5 precious minutes. In a cardiac event, 5 minutes is an eternity. Heart tissue is dying by the second. Walk slowly to your front door, unlock the deadbolt, and if you feel safe doing so, leave the door slightly ajar. Just crack it open so the EMTs can push right in the second they arrive. Right after you unlock that door, you have to secure your pets. I know your dog is your best friend. I know they bring you immense comfort, and when you're scared and in pain, you probably want them sitting right next to you. But you have to put them in a separate room and shut the door. Even the friendliest, sweetest golden retriever in the world will become highly aggressive when they sense their owner is in severe distress. Dogs pick up on chemical changes in your body. They smell the stress hormones. They know something is terribly wrong. When three large strangers in dark uniforms come rushing through the front door, shouting instructions and reaching out to touch you, your dog's protective instincts will take over. They'll bark, they'll lunge, and they'll bite. Paramedics are trained for scene safety. They can't and won't kneel down to start an IV on you if a 70-pound dog is snapping at their faces. They'll have to back out of the room, find a way to trap the dog, and secure the area before they can touch you. Again, you're losing time you can't afford to lose. Toss a handful of treats into a bathroom or a spare bedroom, guide your dog or cat inside, and close the door firmly. Take them out of the equation entirely so the medics have a clear runway to save your life. And what happens next? You aren't ready for this, because this next part changes everything about how you handle the wait. You're sitting there, the door is unlocked, the dog is away, and you're terrified. You might pull out your phone and scroll social media to distract yourself, or maybe you remember a viral video you saw a few months ago. It's called cough CPR, and it's a massive, dangerous myth. The myth claims that if you're alone and having a heart attack, you should take a deep breath and cough violently and repeatedly. The fake science behind it says that the force of the cough will squeeze your heart and keep blood pumping, basically doing CPR on yourself. Don't ever do this. The American Heart Association strongly condemns cough CPR. It doesn't work, and it can actively kill you. When you cough aggressively, you're putting a massive amount of physical strain on your chest and your heart. You're increasing the pressure inside your chest cavity, which can actually trigger a fatal arrhythmia. An arrhythmia is when the electrical system in your heart goes completely chaotic, and the heart stops pumping blood entirely. You go into sudden cardiac arrest. On top of that, violent coughing requires a ton of energy. It makes your heart beat faster, which means your heart muscle demands more oxygen. But remember, you have a blood clot blocking the artery. The oxygen can't get there. You're forcing a starving muscle to run a marathon. Stop trying to hack your way out of a heart attack with internet tricks. Focus on normal, steady breathing. Let the aspirin do the work. Save every single ounce of energy you have. If this step-by-step breakdown is giving you peace of mind, make sure to subscribe. We do deep dives like this every week to keep you safe, healthy, and prepared. Instead of coughing, you need to manage the intense fear that's washing over you. Panic is your enemy right now. When you panic, your brain triggers a fight-or-flight response. It dumps a massive dose of adrenaline directly into your bloodstream. Adrenaline causes your blood vessels to constrict and tighten up, making them even narrower. It also causes your heart rate to spike. Your heart starts racing, pounding against your ribs, desperately trying to push blood through vessels that are now squeezing shut. This creates a terrifying loop of pain and anxiety. You have to break that loop, and you do it through box breathing to prevent shock. Box breathing is a simple technique used by Navy SEALs and first responders to manually override the autonomic nervous system and force the body to calm down. Here's exactly how you do it. You inhale slowly through your nose for 4 seconds. You hold that breath in your lungs for 4 seconds. You exhale slowly through your mouth for 4 seconds. And then you hold your lungs empty for 4 seconds before taking the next breath. 4, 4, 4, 4. It sounds almost too simple to work, but it forces your heart rate to slow down. It stops you from hyperventilating. When people panic, they take short, shallow breaths. They hyperventilate, which blows off too much carbon dioxide and actually makes them feel dizzy and more panicked. Box breathing stabilizes your oxygen levels and tells your brain that you're safe, which stops the adrenaline dump. Sit in that W position on the floor, close your eyes, and just count your breaths. 4 seconds in, 4 seconds hold, 4 seconds out, 4 seconds hold. While you're focusing on your breathing, you want to make sure your medical information is ready. This is a preparation step you should actually do today, right after this video ends. You need to gather your medication list in one pile and keep it somewhere obvious. EMTs need to know exactly what you take on a daily basis before they start pushing emergency IV drugs into your veins. Certain drugs have fatal interactions. If you take blood thinners, the paramedics need to know immediately, because their treatment protocol changes. If you take erectile dysfunction medication like Viagra or Cialis, it's absolutely critical that you disclose it. Those medications are vasodilators. If the medics give you a drug called nitroglycerin to help your chest pain, and you have Viagra in your system, your blood pressure will bottom out instantly. It'll drop so low so fast that it can kill you on the spot. Don't assume the hospital already has your updated records in their computer system. Computer systems fail. You might get transported to a different hospital out of network. You might be unconscious and unable to speak. Write down every single medication you take, the dosages, and any allergies you have on a physical index card. Stick it to your fridge with a magnet, or keep it on a table right by your front door. If you're having an attack, you can just point to it when the medics walk in. It takes 5 minutes to write that list today, and it removes a massive guessing game for the people trying to save your life. But before you do that, there's one silent symptom most women completely ignore, and it costs thousands of lives every single year. We talked about Hollywood conditioning earlier. We're all waiting for the elephant on the chest feeling. We expect a crushing, agonizing pain right in the center of the sternum. But for women, diabetics, and the elderly, heart attacks often present with atypical, silent symptoms. Roughly 71% of women experience extreme fatigue in the days leading up to a heart attack rather than sudden chest pain. They feel a bone-deep exhaustion that makes it hard to even walk to the kitchen. When the actual attack happens, they might feel a weird, dull ache in their lower jaw or their teeth. They might feel pressure spreading across their upper back, right between their shoulder blades. They might experience severe nausea, vomiting, or a sudden, unexplained sense of impending doom paired with cold sweats. Because these symptoms don't match the textbook definition of a heart attack, people brush them off. They think they just caught a stomach bug. They think they slept wrong and tweaked their back. They think it's something they ate for lunch. Stop waiting for the elephant. If you feel a sudden, intense wave of nausea, you start pouring cold sweat, and you feel a strange pressure in your neck or back, you need to treat it as a cardiac event. It's always better to call 911, get checked out, and feel a little embarrassed because it turned out to be heartburn than to go to sleep and never wake up. Listen to your body. When something is catastrophically wrong, your body sends warning signals. Don't ignore them just because they don't match a movie scene. Drop a comment below if you already have aspirin in your house, or if you need to go buy some today. Let's do a quick roll call on who's actually prepared. Now, everything we just talked about assumes you're at home. But what happens if you're out running errands? You need to know the solo survival protocol for public places. Let's say you're walking through a busy grocery store or you're at the mall and it hits you. That crushing pressure, the sweat, the dizziness. Human psychology is very strange. When we feel suddenly ill in public, our first instinct is to hide. We feel vulnerable. We don't want people staring at us. We don't want to make a scene. So what do most people do? They retreat to a public bathroom. They go into a stall, lock the door, and sit on the toilet hoping it passes. This is a death trap. If you're having a heart attack and you retreat to a locked bathroom stall, you're completely isolating yourself. If your heart stops and you pass out, no one is going to find you in time. You'll be behind a locked door, out of sight, while shoppers walk right past the bathroom. If you feel those symptoms in a public place, you have to fight the urge to hide. You need to sit down right where you are, in the most high-traffic area possible. Sit on a bench. Sit on the floor of the aisle. It doesn't matter. Next, you have to defeat the bystander effect. The bystander effect is a psychological phenomenon where a large group of people will watch an emergency happen, but no one will help because everyone assumes someone else is going to call 911. You have to take control. Don't just yell out for help to the general crowd. Look for one specific person. Point directly at them. Look them right in the eyes and give a direct command. Say, "You, in the red shirt. I'm having a heart attack. Call 911 right now." By pointing and singling them out, you break the bystander effect. You assign them a task, and they'll act. Sit on the floor in the W position, ask someone to go find aspirin from the pharmacy aisle, and wait for the ambulance. Never try to walk out to your car to rest. Never go to the bathroom. Stay visible. I want to give you a bonus tip here, and it's something very few people talk about. It's the nitroglycerin rule. If you have a history of heart issues, your doctor might have prescribed you a tiny pill called nitroglycerin. It goes under your tongue, and it rapidly expands your blood vessels to relieve chest pain. If you have a prescription for nitro, take it exactly as your doctor directed, but never, under any circumstances, take someone else's nitroglycerin. Let's say you're playing golf with a friend, your chest starts hurting, and your friend says, "Oh, take one of my nitro pills. It works great for me." Don't touch it. Here's why. There are different types of heart attacks depending on which specific artery is blocked. If you're having what is called a right ventricular infarction, your heart is heavily dependent on a specific amount of blood pressure to keep functioning. Nitroglycerin massively drops your blood pressure. If you take your friend's nitro during a right ventricular heart attack, it'll tank your blood pressure so violently and so fast that it can instantly kill you. The paramedics have to run a 12-lead EKG to see exactly which part of your heart is dying before they decide if nitroglycerin is safe to give you. You can't run an EKG on the golf course. Stick to the aspirin. Aspirin is safe across the board for a suspected heart attack. Leave the prescription drugs to the professionals. We've covered a lot of ground, from the psychology of denial to the exact mechanics of chewing aspirin and positioning your body. But information without execution is useless. You need an action plan. Here's your simple 1-2-3 plan to make sure you're completely ready today. Step 1. Go to the pharmacy right now, today, and buy a fresh bottle of uncoated 325 milligram standard aspirin. Check the expiration date and make sure it's good for at least a year or two. Step 2. Divide that bottle up. Put 3 pills in a tiny Ziploc bag and stash them in the center console of your car. Put another 3 pills in your purse or your work bag. Put the main bottle right on your nightstand next to your bed. Heart attacks love to strike in the early morning hours, right as you're waking up, because of the natural spike in stress hormones your body releases to get you out of bed. Having the aspirin within arm's reach means you don't have to stumble to the bathroom medicine cabinet while you're dizzy and in pain. Step 3. Talk to your family at dinner tonight. Have a very blunt, very clear conversation. Tell them exactly what we talked about today. Say, "If I ever tell you my chest feels weird or my jaw hurts and I'm sweating, we don't wait. We don't try to sleep it off. We don't drive to the hospital. We call 911, I chew aspirin, and I sit on the floor." Make it a family rule. When you remove the hesitation, you remove the danger. Don't just watch this and scroll to the next video on your feed. You have the power to save a life right now, whether it's your own or a loved one's. Start with just step number 1 of that action plan today. Go get that aspirin. Put it on the nightstand. You'll sleep better tonight just knowing it's there, ready to do its job. Stay safe, trust your gut when something feels wrong, and take care of yourself.